In this video, I'm going to be answering some of the most common questions that people have before they have hip replacement surgery. I'm Matt Sigua, a doctor of physical therapy, and I've successfully treated hundreds of patients who had this procedure. And if you're looking to learn more about hip replacement recovery, keep watching. How long does the artificial joint last? So with a total hip replacement, they're generally very successful, and more often than not, they're going to last at least 20 years. So most people, if you're getting this, after age 65, they're lasting for the rest of your life. So it's not as often that you'll see people requiring like a hip revision or where they need to go in and, maybe change out a part or have to adjust a loose like socket. So generally, once you get that total hip replacement done, nothing else is needed surgically. It's really just maintaining a certain level of strength training, flexibility. So you're doing all your physical therapy exercises to make sure that all of the soft tissue and structures around the joint stay strong but also mobile. But to answer the question, usually they're lasting at least 20 years. How long will swelling and pain last? So after the total joint replacement, this is a surgical procedure where they're removing and replacing parts with artificial parts. So you're going to definitely expect to have some level of swelling, pain, bruising, a lot of just fluid around the hip joint. Now, typically that first 4 to 6 weeks, essentially that first month after the surgery, you're going to be dealing with post-operative symptoms. So all that inflammation that we talked about. It's going to vary person to person in terms of how severe it is, but it's really well managed and with ice, with some level of pain medication. It's very tolerable for most people as long as you're abiding by the hip replacement precautions. You're not doing the movements that your physical therapist and your doctor instructed you to avoid. You're maintaining a certain level of your home exercise program, so then you're not allowing the hip to get too stiff. You're also working on turning on some of those muscles around your hip and knee so that it makes it a little bit easier for you to walk, and you're using more of your muscles to help take some of that load off of your hip, especially when you're standing and walking. But in terms of how long it takes for swelling and pain to last, you can definitely expect that first month, that first 4 to 6 weeks, to have some degree of post-operative swelling and pain. Now, once you get past that and you're around the 8-week mark, a lot of that should be controlled and essentially should be very minimal to completely gone after 6 to 8 weeks. When can I sleep on my side? So with the hip replacement on either side, obviously, you can sleep on the contralateral or on the opposite side with a pillow between the knees. So for some people, that still will be not as comfortable depending on the size of pillow that they're using. But the main thing is if you're going to sleep on your non-surgical side, you do want to have a pillow between the knees that just kind of keeps the hip, that surgical hip, in a more neutral position. If you don't have a pillow, then that hip is going to be kind of, it's called adducted, or kind of like knees will be together, so it's going to be at an angle where there's more tension on some of the structures on the outside of your hip, as well as on the inside of your hip. There's going to be some compression or more pressure on the inside of your hip. So ideally having that pillow just keeps your hips in a neutral position. Now, in terms of when can you sleep on the surgical side, I usually tell my patients that try to avoid sleeping on that surgical side that first 4 weeks, just so we can get the swelling more under control. And then also you allow those soft tissues to heal a little bit more. The incision heals a lot more by the 4-week mark. It's pretty much closed by 4 weeks. Now, in terms of sleeping positions, back is usually the most comfortable out of the side sleeping positions. You definitely don't want to sleep on your stomach, but lying on the back is going to be the most comfortable. And typically I'll recommend waiting at least 4 weeks to sleep on that surgical side, but it also varies person to person. But more often than not, 4 weeks will be the time that I'll tell people that they can try to sleep on that surgical side and not anytime sooner. Will I need a walker or a cane? Yes. So you're going to be using both assisted devices right after the surgery. You're going to be starting off with that front wheel walker. Now, typically the goal is that you're discharging or you're trying to transition from that walker to the cane, and that can be a quad cane or a single point cane, between the 2 to 4 week mark. But it's not uncommon that people will still require a walker at maybe even 6 weeks. It all really depends on your prior level of function, like what if you're using an assisted device prior to the surgery, and then just what your physical activity level was like before the surgery as well. So that's gonna really dictate how long you're gonna be requiring the actual like walker. But ideally, once we hit that 2 week mark, if you're demonstrating good signs, good physical signs, such as you're tolerating weight bearing on that surgical leg to where when you're walking, you're not walking with a limp, right? It's you don't have that antalgic gait pattern, so you're kind of looking a little bit more normal when you walk with the walker. And if you're able to demonstrate that for example, for at least like 5 minutes, then typically we'll try to transition you to a quad cane or some sort of cane where now we're going to do very short distances with the cane, as long as you're able to tolerate that weight bearing with less support using the cane, and also you're not demonstrating that limping pattern with that cane. But 2 to 4 weeks, we're trying to transition from walker to cane, but essentially you will need both. It's very rare that someone would go from having that walker to not go into another assisted device right after. Typically, that's going to be a little bit of bad practice, because if you go from that walker to nothing, you might be able to manage in terms of you're not like a fall risk and you can get from point A to point B in terms of like short distances, but you might be limping, you might have poor walking or gait quality. So ideally, we do want to make a smoother transition from the walker to the cane. Am I too young for a hip replacement? So, in terms of the total joint replacement for your hip, it's not necessarily an age limit where you have to be this old to need a hip replacement. So, for example, someone who's in their 30s, but let's say they either have some avascular necrosis, they have just severe arthritis from, could be from a traumatic event like a significant fall, could be just maybe they are participating in a significant physical activity that put a lot of pressure and stress on their hip joint, that their hip has been through a lot of wear and tear and a lot of impact and received a lot of and accumulated a lot of damage to where they have moderate to severe hip arthritis. And now maybe for that individual who is in their 30s, maybe their symptoms are one, just persistent, regardless if they're moving or not moving, or they have significant stiffness where they lost range of motion, or even maybe they tried pain interventions and physical therapy, so all the conservative type of interventions to improve their hip pain. So if a younger individual is kind of presenting with those kind of symptoms, then they would likely be a candidate for a hip replacement. So it's not exactly you need to be this age. It's more likely that, how bad are your symptoms to determine if you're a candidate. If you want to learn more about what exercises to do after hip replacement surgery, watch this next video.